Real Country 1430 AM and 107.3 FM WRDN. Brian Winnekins from the NAFB Convention in Kansas City. Thank you to our broadcast sponsors, including Synergy Co-op, Osteoplastics, Compeer Financial, also Animal Wellness Center of Buffalo Valley, Annabis Silo of Durand, and Elsivia Co-op. And joining me this morning is Scott Heiberger. He's Communications Manager with National Farm Medicine Center, just up the road in Marshfield, and talk about some of the things going on with the Farm Medicine Center. And Scott, thanks for joining us. Well, first, one of the big events that the Medicine Center was kind of part of with Pittsville Fire Department was the Firefighter training. And apparently there are a lot of people from a lot of departments there.
Yeah, that's a project we really enjoy doing. It's very much community oriented, very popular. Like you say, we had this year approximately 30 fire departments from around the state, training almost 100 firefighters in EMS. It's a tradition at Marshfield. It really goes back over 40 years probably. There was a series of trainings at that time. At that time, they trained approximately 1,500 firefighters around the state. Then there was a lull, but then a couple of years ago, we were talking and realizing, those folks are retiring. We have a new crop of firefighters. And if anything, the current crop of volunteer firefighters, most of them are volunteer in these communities, didn't grow up on farms. And so there was a real need, we think, to train the current group in when you arrive on the scene, what are you going to find there? What types of hazards should you be looking for in a farm situation? So the people that work on that project in Pittsville Fire and several local fire departments did a fantastic job. It was a day and a half. And this year, there was a new twist to it. Since we want the program to spread, and we want it to spread more than just doing one training a year in one state, we did a train the trainer aspect to this ag rescue training weekend, and approximately 15 individuals went through that, and so they'll be able to go to their communities and run something similar, and we'll be able to spread this good project out.
Meanwhile, the Farm Medicine Center is celebrating 25 years, and really it kind of started with protecting kids on the farm, it seems like.
Yeah, the National Children's Center for Rural and Agricultural Health and Safety is 25 years old. That center is nestled within the National Farm Medicine Center, which actually celebrated its 40th anniversary last year. But you're right, the National Children's Center programs and projects have been a real mainstay of the National Farm Medicine Center. This year is 25 years. The thing that we point to that gives us a lot of satisfaction is when you look at when the center began 25 years ago to now, the rates of childhood ag injury have gone down about 60%. That's for non-fatal injuries. Now, for reasons we don't quite understand, the fatal injuries have held steady at around 120 a year. But the rates of injuries, that's, I think, a reflection of maybe some of the leadership of the Children's Center. But I think attitudes are changing. I think people are more open to safety attitudes. If you have folks growing up using bicycle helmets and car seats and stuff like that, safety just is a little more routine possibly. So it's definitely been a group effort, but the Children's Center and its programs, they're funded for another 3-4 years in this current cycle. We have a lot of great programs, everything from mental health research, looking at within families, we talk about stress on farms, and I might be going off on a little tangent here, but I think this, for the Children's Center, it's a good example of the looking at things that are important to farmers and farm families. We talk a lot about stress and things that farmers can't control, elements they can't control. But has anyone looked at the stress that a family has, a couple might have? Does that rub off on the kids? And so there's a project underway right now looking at that, and if it does, what can we do differently as families and health people to maybe mitigate some of that? So going strong and looking forward to continuing to work in child ag safety.
Talking with Scott Heiberger, he's Communications Manager with National Farm Medicine Center. You mentioned that with the mental health, and that is something, though, I think a lot of times parents think, we're insulating the kids, and they don't know. But the reality is, and I'm sure that your studies are finding this, the kids do know, the kids feel it, and the kids are having to try and deal with this.
Yeah, and for any of us who are parents, you think back to your parenting and like, gosh, could I have done something differently? But what you say though about that insulating, that's my first instinct. It's probably a lot of parents' first instincts is like try to insulate it, but if it's in the house, the vibes are there, and so we're looking forward to seeing what we find out. Some of the preliminary evidence is that yes, it certainly does have an effect, and you know what, that's okay. I mean, maybe it just changes a little bit then how we approach it. Maybe we're more direct with our kids, instead of trying to put up the wall there, we have a frank discussion, and maybe say, these are some of the things that are weighing on us, and it seems a little counterintuitive maybe, but maybe by sharing more and being more transparent with your kids, it could help the situation. But definitely getting ahead of myself there. That's why we're looking at this, and we'll see what the data indicate. But really a worthy project.
That is Scott Heiberger. He is Communications Manager with the National Farm Medicine Center from Kansas City in the NAFB Convention. I'm Brian Winnikins for WRDN.